Okay, this lady has chronic cystitis and she is having the disease for 9 years, and she used I think 7 years actually. And when I look inside, we were expecting to find these leukoplakias because she didn't use the antibiotics for very long terms. The longest term she used is 7 months, and she couldn't tolerate antibiotics, and she is now treated with nitrofontaine only. I'm checking the rest of the bladder. The side walls looks alright, no problem, and the rest of the bladder. Here, this red area, it is the place that this part of the bladder comes into contact with the leukoplakia part when the bladder is empty. Let me check it. I will empty the bladder to see if it is true. So this part, there is a red part here. Now I am emptying the bladder. When compared to this part, this red part seems more diseased. Now we empty, and look, it comes into contact when bladder is empty. Now bladder is empty. I am just filling it a little bit, and this part, the red part, comes into contact with the leukoplakia tissues. That's a proof for me that there is some problem. There is some problem, and this problem is affecting this part. It's when the bladder is empty, these two places are in contact, and also this part comes into contact with this part. And all of the parts of the bladder which are in contact with the infective tissues are affected. So in some ladies, the infection stays too long, and all the bladder walls are inflamed and affected, so their healing is very much longer. So this is a proof for me that the bladder problems here is related to bladder problems in the trigone. When the bladder is empty, this place comes into contact with this place. So it's a proof for me bladder problems starts from here. So I have to heal these tissues. They come to the bladder neck. I have to stop here, and urethra. Okay, here some tissues also, and in the upper part it seems normal. The rest of the urethra seems normal. Okay, pause.
Good.
So once again, look at this. This is the urethra, and we fulgurated now this part, and I am filling the bladder, and this part is in contact with the trigone. So I want to fulgurate a little portion of this part. When I fulgurate these, new tissues will be formed here, and this new tissue will be healthy. I don't want to take the risk of leaving some infection here. So this is a normal healthy mucosa. This is an inflamed mucosa. And I am sure it is because of being in touch with trigone area. Now we fulgurated the trigone. These are the rhetoric orifices. The inflammation was going a little behind the trigone. We fulgurated this part. There were some deeper tissues. We fulgurated deeply. These are the healthy bladder mucosa. This is done. And I will check the vaginal part now. Also. This is cervix uteri. The vaginal wall seems healthy. This is cervix. There is normal amount of vaginal discharge, and these are the cervical tissues. This seems to be quite normal. There is no abnormality.